Hello, Dr. Brianna Andert here, family physician at the Newell Medical Center, and just wanted to take an opportunity to talk a little bit about mask use and why we in healthcare would agree with Governor Walz's mandate in regards to masks in public settings, and why we think that it is a good thing in the midst of the COVID pandemic. Using masks in particular in public and in situations where it's difficult for physical distancing to occur, the recommendations really would be mask use, and that use of masks is going to help with preventing ongoing spread of COVID-19. Masks are really going to be providing what we call source control, and so I want to explain that a little bit. So wearing a mask in public is less about the mask protecting me as an individual, and it's more about protecting other individuals from my germs. So I am the source of infection, potentially, and me wearing a mask controls the source and limits the amount of germs that I am going to be expelling out into the environment and to the air around me, and so is then protecting other people from my germs. I think that's important to understand. I know I've seen a lot of stuff. I know mask use is an emotionally charged topic for a lot of people, and some people have really strong opinions and beliefs about it. But I think it's important to understand that it really is not so much about you, and it's about your role in preventing germs and spread of COVID-19 to other people. So it's really more of a humanitarian type of a situation, and it's really about what you can do for the common good of others. Of course, still super important to be thinking about washing our hands, staying home if we are sick, practicing some degree of social distancing whenever it is possible, because those are still going to be important strategies as well. But we do know science and evidence are showing that use of masks, in widespread type of situations like a mask mandate, it really is helpful, and it is one of the best things we can do to control the spread of COVID-19. I want to talk briefly about how to wear your mask and some important things on masks. So for those of us in healthcare, we're using surgical masks and we're using N95s when we're dealing with patients. N95s are going to protect me as an individual, so I think it's important to understand that, but really guidelines and recommendations would not say that N95 use is what's recommended across the border and when you're out in the community. So an N95 protects me when I'm taking care of patients, yes. A surgical mask is not quite as good as an N95, but a surgical mask is still going to be pretty good. And then a cloth mask is going to be under that, not quite as good, but definitely better than nothing. So a surgical mask, if I am going to be wearing a surgical mask, surgical masks are going to have that wire up top. Benefit of that is that I can really fit it to my face, and that can help with some of the fogging of eyeglasses. So if I've got a pretty good seal over my nose and upper face, I'm not going to have as much fogging with my eyeglasses. So important to see my nose is covered, my mouth is covered. Okay. If I've got a cloth face mask, same thing. And cloth face masks are going to come in a lot of different styles and like different shapes. Some of them have like more of a fitted type of a feature, different shapes. Mine is just kind of that pleated type so that I can pull it out. Same thing. It's going to be important that I get it up around my nose. Now this cloth face mask that I have does not have any kind of metal. So I am going to get probably a little bit more fogging in my eyeglasses, but again, I'm covering my nose. I've extended it down so I'm covering my mouth. If my mask is not covering my nose and my mouth, it is not serving the optimal purpose that it could. The respiratory droplets that we are, trying to protect other people from, those respiratory droplets are coming from my nose and my mouth. So you got to cover both. With a surgical mask, in many situations, this may be a one-time use. If it was a really short duration of time, you may be able to save it and use it more than once. I think just be cognizant of how am I storing it and how am I saving it to, help it to prevent other kinds of spread to germs. With a cloth face mask, you should really be washing this every time that you wear it. Are face masks hot? Definitely, yes. Do your glasses fog up? Yes. Is it sometimes harder to talk with them on? Depending what you're doing, does it make you feel like your breathing is labored? It may make all of those things happen. Are they super comfortable? No, they may not be. But I do think that they are very safe to use. So there has been absolutely no science that has told us that there is any harm to a person's oxygen level or that there is any retention of carbon dioxide with the use of mask. So oxygen particles, very small, carbon dioxide particles, very small, respiratory droplets, lots bigger. So the mask is going to help to hold the respiratory droplets and prevent those from going out into the air around us. But we are still going to have exchange of oxygen and exchange of carbon dioxide. So we in healthcare, we have been wearing masks, all through this pandemic. Some of my other medical colleagues, so the surgeons, they've been wearing masks in the OR for years, and none of us have gotten carbon dioxide poisoning. None of us have had poor oxygenation. So takeaway, these masks are very safe to use. Most of the medical bodies have really come out with recommendations. Across the board, medical bodies, specialty medical bodies are really all in favor of mask use. Some of the things I've heard is asthma and COPD, and maybe, would those be a reasons why a person shouldn't wear a mask? Like, is there a higher risk of wearing a mask because of my ability to get oxygen? And that's not the case. Folks with asthma, folks with COPD, really the recommendation is going to be that you should still also be wearing a mask, and probably even more so than the general or healthy population, because individuals with asthma or COPD are going to be even higher risk if you were to contract COVID-19. With kids, I know Governor Walz's mandate is ages 5 and above should wear masks. Many of us in healthcare would say that really kids ages 2 and above, it might be appropriate to wear masks. I think you do the best that you can with kids. I do think that with kids, it's really important the message that you're giving them as an adult and how you are telling them about the mask and what you're telling them it's for. And so I think, just being cognizant of your choice of words and how you present it to your child does go a long way. And that goes in just a little bit to my general recommendations that mindset is really, really so important, and the thoughts that you have about masks right now in this just totally wild and crazy time that we are in with COVID-19. The thoughts that you choose to have about your mask are going to be really powerful. So if you are going to just come at it with this completely negative, I hate masks, I hate wearing it, no one should tell me what I should be doing with my body, then for sure your experience with the mask is going to be negative. If you come into it with a more positive outlook, not that you have to come into it saying, I love masks, I can't wait to wear it, this is all so great and wonderful and flowery. I'm not saying you have to go to that extreme, but if you come into it with a mindset of, hey, this is what I just have to do. This is where I'm at in life, and this is what I'm being asked to do to help others around me, and realizing that this is bigger than just me. Coming into that with that slightly different and slightly more positive outlook, I think your experience with it will be better. So our thoughts are so powerful, so powerful. The American Lung Association has a few other recommendations. You probably could look this up on the website if you'd like. Again, American Lung Association, and that website is lung.org. And so they do list some steps that you can do to get used to wearing a mask. So I'm certainly aware that for folks who don't have to wear a mask on a regular basis, it is a change, and it does take some getting used to it. So it might not be realistic for you to go from never wearing a mask to wearing a mask for 8 hours. That might feel more painful. So number one, American Lung Association says think positively about the mask and about the use and mindset, and especially a mindset of I'm going to make this work. They recommend practicing at home. So they actually say, don't just jump into the deep end. Maybe put your toes in the shallow end first. So try wearing it for a shorter period of time at home. try breathing through it, try talking with it, some different things to just get yourself used to it. And then also just getting creative. And if there's something about your mask that really doesn't feel comfortable, if it's feeling tight on your ears, if you feel like the size is wrong, getting creative and exploring some different mask options or some different shapes, or maybe using a different type of an earpiece for how you attach it to your face, trying some different things to troubleshoot and being creative. And then they also, of course, do mention talking to your doctor if you continue to have significant struggles. And absolutely, we are here to talk about those things. We do generally want to make sure that the message to our community is clear that it is going to be really rare, based off of science, based off of medicine, based off of recommendations from specialists. It's going to be pretty rare that a person would have an exemption to a mask. So, just because the mask may not be comfortable for you, just because it may not be super fun to wear, you may have certain diagnoses. There are going to be a lot of things that we would recommend to try to just accommodate and try to make the mask work. It's going to be rare that your physician is going to tell you that you're exempt from wearing the mask. So carry on, good luck, be well, and let's wear those masks